Hello, I'm Michael Pierce, and this is The Human Condition. Today, we're talking about vocal dysphonia and vocal dystonia. This is a controversial topic in that we don't have a cure for any dystonia or dysphonia, but we have some methods that have been proven anecdotally and clinically to make a difference, but they're highly individualized. And so I want to acknowledge many other doctors besides me that talk about individual personalized medicine, because you can't make a cookie cutter method. You can't say that science determines that one treatment is going to be for everybody. It's quite different. But essentially what the subtitle of this would be, how would I treat Robert F. Kennedy Jr. if he were my patient? Now, Robert F. Kennedy Jr. is a famous living person today who is one of my heroes. He is the head of Children's Health Defense, and he has probably one of the most famous cases of vocal dysphonia, where it's pretty classical. You can see and hear it in his voice and in his speech, and it's a sad case that I believe happened from a medical intervention that went wrong. And so he didn't always have this. It happened to him as an adult. And this difficulty gives a characteristic speech pattern of interrupted glottal stops, where the person's problem is not in their diaphragm so much as it's in their vocal cords, and it's in the intrinsic control of their vocal cords that is unconscious. And this pathway is partly in the cortex of the brain, but very, very much in the basal ganglia and in the cerebellum of the brain, which are the automatic control pathways that control how our inner vocal cord control muscles work and outer vocal cord control muscles work. So Robert F. Kennedy Jr. is a public person, and so he's subject to us discussing this, so I'm not diagnosing him. He's already been diagnosed, and I'm not treating him. I'm just proposing what I would do and have done treating other people with this difficulty, and how it's worked well for me and for them, and how I would do it if I were working on him. And he's a big boy. He can handle this if he sees this video. So, Robert, we would like to talk about how this would work, and the most important thing is to say that the basal ganglia is the feature of the brain that we're looking at. It's the anatomical area that is involved in this problem. So the basal ganglia and the cerebellum control the unconscious control of things like speech, things like midline structures, things like the spine. They control involuntary balance and timing and the ability to do things that we don't control consciously. Now, I know we control our speech consciously, but we don't control our vocal cords so consciously unless we're singing. And even then, there's parts of it that we don't control. The tone of these things is controlled naturally and unconsciously, subconsciously. For example, we don't pay attention to our pelvic floor while we're standing and speaking. We don't pay attention to the soles of our feet while we're maybe cutting wood with a saw. So all of these tasks are done naturally and spontaneously and subconsciously. So the difficulty that you would see in the speech of someone with vocal dysphonia, or Robert F. Kennedy Jr., for example, is this catching up the voice, where it seems like they have caught their voice with their diaphragm. And what's really happening is there's a catch. It's not always glottal, which is the epiglottis. Sometimes it's the actual vocal cords constricting. Those are two different mechanisms by which a person can restrict their flow of speech. And it's very, very often one side more than the other. And in Robert F. Kennedy Jr.'s case, it seems to be, and I can't be sure of this, but it seems to be visually much more the left side of his body and his neck. He has much more of a cervical dystonia that takes him off to his left side, gives him a left downward tilt of his head, gives him a more of a head tilt and left neck contracture. When he speaks and dynamically speaks, there's a lot more contracture on the left side and a lot more cervical dystonia, or increase in tone, on the left side. Now, this typically goes with the problem of the opposite basal ganglia, which would be the right side basal ganglia. The mechanisms are pretty clear in neurology, and I don't have time to go through all of them, but basically the basal ganglia and cerebellum control tone and alternating movements. They control the ability to turn on and off muscles, so they're perfectly adapted to controlling things like speech and things like posture and things like stability when we do movements. Now, some of the movements that we do that are affected by the extrapyramidal system, which is the basal ganglia and cerebellar system, involve rapid alternating movements. Movements like this, and movements like this, and movements, there's a whole number of movements that a person can engage in that are rapid and alternating movements. We do them with the spine, we do them with the limbs, we do them with the tongue, and so these rapid alternating movements are something that we can test for. So if I were examining a patient with this, or Robert F. Kennedy Jr., as I said before, we would be doing a complete neurological examination to see if we can localize problems of the right or left bias more than the other of the basal ganglia and of the cerebellum. Now, the basal ganglia are deep structures that are deep in the brain. If you were to separate the hemispheres and look deep in each hemisphere, there's these floating nuclei or ganglia that are inside the hemispheres, right about here and right about here. And they have names like the caudate, the putamen, the globus pallidus, internus and externus, the subthalamic nucleus, and some other structures like the claustrum. But in any case, these are structures that are the ones we would want to examine and use our history and examination procedures to see if we can localize that those are part of the problem. Because there are various rehab exercises we can use to target those areas to try to corral them back to normal function, sometimes. We also need to know that the basal ganglia is very, very sensitive to heavy metal toxicity and chemical toxicity. For some reason, that area of the brain has more sensitivity than other areas, and it seems to be in the literature much more sensitive to heavy metal poisoning. So I would want to do not an acute poisoning test, which is a blood test, but I would want to do a chronic poisoning test of the hair for Robert F. Kennedy Jr.'s hair. I would want to take a bunch of hair from the back of his, not a bunch, but a little bit from the back of his head. It's a gram or two. I'd send it to a laboratory. I would send it to Great Plains Laboratory in Lenexa, Kansas, and I would have it molecularly examined to find out what heavy metals profiles it had. The most reliable method of chronic heavy metal analysis is hair metal analysis. We're not talking about mineral analysis, we're talking about heavy metal analysis. That is a reliable method, and it's been used in court testimony, and it's significant for measuring that problem. I would then want to, if I found these heavy metals, I'd want to detoxify this person. I'd want to be able to detoxify them using various methods, which we'll get into in other videos. In some cases, the heavy metals will be quite high, and you'll see that they're quite high in the hair, and I would want to help that person detoxify to help their basal ganglia. Now, it may take a while. Sometimes detoxifying heavy metal from the brain takes a while, so it could take a year or two to really get good changes in detoxifying those heavy metals from the brain. Do I know which heavy metals it'll be? No, I don't. It could be a mixture of uranium, lead, mercury, cadmium. We don't know. We don't know exactly. Certainly aluminum, which is a borderline heavy metal. We're not really sure, what form it would be and if it qualifies, but that's another one we would want to look for. So just to review, we're looking at laboratory evaluation. We'd also want to look at, aside from laboratory evaluation and neurological examination and history, we'd want to do some kind of analysis of urine toxicity. I like to do Great Plains urine toxicity. It's called GPL tox, which is a test of man-made chemicals. These are solvents and things like the chemicals from gasoline, like MTBE. You may have studied some of the metabolites of gasoline and other pesticides and herbicides that come out in the urine. We can measure the total body burden, not the antibodies, but the total body burden that's actually in a person's body coming out through their urine to see if they have these chemicals, because these chemicals can cause problems in the basal ganglia and the cerebellum. I would want to know if he was better or worse with alcohol, because one of the tests we use in neurology is we say, if you drink alcohol, does your movement disorder, of which this classifies, does your movement disorder largely get better or worse? It would tell us a lot about the cerebellum specifically, because the cerebellum in the back of your head here is about as big as your fist. And it's very, very wrinkly. It's much more wrinkly than the brain. It has much more gyri or wrinkles in it. It's much smaller, but it has more nerve cells in it than the rest of your whole brain combined. So it's a very densely packed area, and it's largely unconscious. So it's an area that has to do with control of factors that not only control your voice and your spine, but they send messages up to your basal ganglia to keep your basal ganglia in order. And the interesting thing about the cerebellum is there's a cortex or rind on it. Much like if you peel an orange, there's a rind that's got a certain thickness to it. And that cerebellar cortex is largely inhibitory. And the cerebellar cortex contributes a whole load of calmness to the brain. It provides a whole lot of factors of signals that go down into the cerebellum and tell the cerebellum to be quiet so that the cerebellum doesn't wake up the rest of the brain at an excessive amount. And if you don't have a good cerebellar cortex, if you don't have good inhibitory neurons throughout that area that are very stable and firing these shush messages all the time that say, be quiet, then your brain is going to be very noisy, and it's not going to be able to handle signals that are very precision signals. So for example, if you're a pilot, or if you're a figure skater, or if you're somebody that's a precision shooter, or a surgeon, if you've got terrific motor control and stability, you probably have a very good cerebellar cortex, and you have a very good basal ganglia because you don't tremor or shake, and you don't have excessive movements, and you can inhibit other movements, and you can control yourself quite well. Because when you do your cuts as a surgeon, you're inhibiting all the other movements of your body and your limbs so that you can make that one exact movement. We want to make sure there is not insulin resistance. We want to make sure that we do blood tests to check for that. We want to make sure that there isn't autoimmunity. So we want to be testing an immune panel to look at antibodies to see if there are antibodies to the basal ganglia or to the cerebellum or to white matter in the brain, like MOG antibodies. There are myelin-specific antibodies that are antibodies to the oligodendrocytes inside your central nervous system. Further, we'd want to do some measurements of his environment and check for EMFs. We'd want to make sure he wasn't exposed to a great deal of EMFs because electromagnetic frequencies that are not ionizing radiation, not X-rays, not gamma rays, but regular old cell phone stuff and computer things and network in his home, in his office. We'd want to make sure that he wasn't exposed to excessive radiation or possibly dirty electricity, which is something that can be measured scientifically. We want to make sure he isn't exposed to poor grounding in his home or office where the building is poorly grounded. If it's a poorly grounded building, it may have stray voltage. And stray voltage has been known and proven in veterinary medicine to cause mastitis in the udders of cows. We want to make sure that there aren't EMFs that can be affecting his brain. We want to make sure that there aren't antibodies and autoimmune reactions that are affecting the brain. We may want to measure total IgG, IgA, IgM, and IgE, which are the total antibodies. We may want to measure complement, which is another immune factor. So there's a load of things that we want to measure, and we can affect those through diet and supplements. We can affect those through chiropractic, and we can measure the outcomes, and we can measure the voice, and we can see if that helps beyond just, say, a couple Botox injections in the neck. Now, not to say that Botox is bad. It can be a very valuable tool for people, but it really doesn't last very long, and it doesn't fix the root cause. So we want to try and fix the root cause, and we want to try to use outcome measures, which is the core and essence of evidence-based medicine, so that we can eventually establish that this set of treatments may be useful for a person like R.F. Kennedy Jr., Bobby, with a vocal dysphonia and with natural methods. One of the most important things of the treatment regimen would be stabilization exercises. We would have him stand on one leg and do various exercises to try to stabilize the spine, because the signals that go from the spine to the brain really prepare the reticular formation, the cerebellum, and the basal ganglia for how its output will be. So you may ask, well, what does the spine have to do with the relevance of the voice? And I would say that the relevance is that the pools of neurons that work together to fire accurate working in the voice box are exactly coming from the stabilization of the spine. So garbage in equals garbage out. If you've got bad information coming up the spine and you're not integrating it well, it has to be trained, and so that you can get good output going to the voice, being able to stabilize that voice and make it more steady. I've been vocal instructor and I've had vocal instruction. I've been a doctor, I've been a musician, I've treated patients, I've been a chef, and I've been able to help people with their food and to help them detoxify and help them get the right foods they need for their illness. And I think that it's very important to talk about how, while this is medically, technically not yet a curable disease, that we've had good results with it, and we need to talk about this issue of many, many illnesses and diseases that don't have an official cure, but there's promising new things that need to be studied, and we need money to study them. We need to study outcomes that are evidence-based. We need to be able to show which mechanisms are causing the problem that makes the person manifest their illness, and it's usually multivariable. It's not just one thing. Heavy metals, toxic poisons, EMFs, poor integration of postural integrity, the need for retraining of spinal stability and vocal stability, the ability to learn how to use your voice, the ability to learn how to use the inner vocal cords versus the outer vocal muscles, the ability to control breathing and breath, the ability for the person to detoxify, and the ability for them to look at their insulin resistance. It's also very important to do QEEG brain mapping to see where the brain waves have gone wrong and to use various forms of neurofeedback dependent on what we find to help that person get better. And sometimes we may even use QEEG to decide which medications to take or which medications to not take. So there's a lot of things we can do for vocal dysphonia, and Bobby, thank you for letting me pick on you today.